Hi, I'm Erika, Ulrich, and today I'm going to be doing my health assessment on my boyfriend Cody. I have my computer over here so I can follow along. Okay. So first we're going to start off with the general survey. Cody, do you know where you're at right now?
Yeah.
Where are we?
Our apartment.
Okay. What's the date today?
November 3rd.
Perfect. Okay. Who's the president?
Joe Biden.
Yep. And state your full first name and last name.
Cody Kyling.
Okay, so he's alert and oriented ×4. So his general appearance to me, he looks really good. His ability to hear and speak is really well, because I'm speaking to him right now and pretend I washed my hands before I came in. And his posture is good. His skin looks good also. And now I'm gonna have him come and walk so we can check his gait. So Cody, if you'll stand up and walk that way a couple of steps. Perfect. Turn around and come back. Perfect. Now have a seat for me. So he did that really well. He walked good. Now we're going to assess his feet, so his pedal and push. So I'm going to have you push down on my hands. Perfect. Now push up. Perfect. Really good on that. Now we're going to start with his vital signs. So I don't have a thermometer, but his temp is 98.5, so that's good. He's not running a fever or anything. Right now we're going to assess his radial pulse. Make sure we can feel it. It's really good, so 3. We're going to assess it on the other side. That one's really good too, about a 3. Now I'm going to assess it for a full 30 seconds. Starting now. Okay, so his pulse was 62, so really good. Now, and I counted his respirations with that. His respirations were 18, so that's good also. He's not having any troubles breathing. Now I'm going to assess his brachial pulse, and we're going to want you to take your sweatshirt off. 3 and bounding, very good. And I'm going to grab my blood pressure cuff. And we're going to take a blood pressure on him. Do you have any arm that I could not do this on, or are you fine?
I'm fine.
Perfect. Okay. I got 116/68, which is really good. And I can hear it really well. Perfect. Okay. And we also assessed his brachial pulse. And what's your pain level?
0.
Perfect. He isn't in any pain, which we really like to see. And I don't have a pulse ox, but his O2 is 98, we'll just say. And now we're gonna move on to your head. We're gonna assess your hair. Your hair looks good. Do you have any problems with dandruff or anything?
No.
Okay, perfect. And his face looks symmetrical, looks really good. Now I need to get my pen light. Okay, so first we're gonna do the cardinal gaze and assess his eyes. So I'm gonna have you follow my light. I'm gonna keep it off so we're not straining your eyes. Perfect. Now we're gonna assess his eyes with a light. Okay, so stare at my nose. Oh, there we go. Okay, that one was good. Perfect. Okay, so his eyes are good. Perla, pupils are round, equal, and reacted to light. We're also going to assess his mucous membrane, so I'm going to have you open up. Yep, very moist. That's good. And his teeth look good. Teeth look really good. Okay. Now we're going to assess your jugular vein distension, so I'm going to have you look that way. Good. Now I'm going to have you look that way. Good. Now on here, I'm also going to assess his carotid artery. About a 2. That one's also about a 2, normal. Now, everything looks good there. So now we're gonna go on to the upper extremities. We're gonna do his grip. So I'm gonna have you squeeze my 2 fingers here. Good, one more time. Good. Okay, and that his grip strength is really good. We're gonna check your capillary refill. Really good. Perfect. And so these are pulses. We've done a brachial pulse, a radial pulse. So we're good on that. His chest, we're gonna listen to his heart quick. So the apical pulse. 2 and normal, I'll count it. And I got 60. So he's still in the same range. And we're also going to listen to your lung sounds real quick. Take a deep breath. Good. This one. Good. Good. I'm going to listen to him on your back. Breathe in. Good. 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 Lung sounds are clear, no wheezing, none of that. And we did your apical pulse. We're gonna check your skin see if it, perfect. That looks good. Okay, and now we're gonna move on. So we did bowel sounds for the no, we gotta do bowel sounds. But the shape looks good, and then we'll do a little bit of a light palpitation. Tell you to stay. Good. We're also going to do a light palpitation. Everything feels normal. Now we're going to go on to his lower extremities. We've already done the pedal push and all of that. We're going to go on to the pulses. So I'm going to check your dorsal pedis. Normal. That one's about a 2. The other one was about a 3, so those are good. And he has no signs of edema, and his temperature also feels good. Any concerns you have? Any like back pain or anything like that that we need to be aware of?
No, nothing. My back hurts all the time.
Okay, well, we'll have to do something about that. But anything else? Any concerns you have?
Nope, in tip-top shape, Doc.
Perfect. And that is it.